Dr. Alejandro, how are you, sir?
I'm doing pretty good, Rich. How are you feeling?
Doing good. I'm getting better every day. I am scared about coronavirus starting to circle our area. We used to just talk about it, but it wasn't here yet. Now it's here, and it's spreading, and all kinds of stuff's happening. So, can you give us an update, a full update for the area, please?
Um, yes, it's here. We've seen some cases, and we've seen an increase in the amount of cases. There's currently, I believe, 29 active cases in Nosara. The problem is health ministry is overwhelmed with the amount of cases, so they have had difficulty doing the notifications. So there could be more cases than actually the official numbers. And well, that's to be expected, but hopefully the most important thing is that people take care, that you are a little bit suspicious about everybody that is not in your social bubble. And let's see how it goes. I know health ministry is trying to do their best. There's always a chance of going into orange alert, which at this moment is not so restricted, but there would be some restrictions because the amount of cases is similar to the amount of cases the amount of cases in Nosara is similar to the amount of cases in Nicoya, only the population density is lower. So that is kind of what keeps us on the yellow area. But let's see. It's most important thing is that it's here, that it's difficult to determine who has it and who doesn't. Hopefully everybody that it's positive or symptomatic is staying home, but there's a risk that they're not. So just be careful, wear your mask, wash your hands, and be a little suspicious of anybody not in your social bubble.
So, it's safe to say there's more cases out there than what's being recorded, and you're saying we're about to have a change in the testing procedure here?
Okay, there's a couple of things on testing. Health Ministry is having difficulty. Health Ministry and CAHA are having difficulty testing everybody. We are doing COVID tests at our office. They're obviously private, and but we're able to determine through the PCR testing, which is the one that goes in your nose, that will determine if you have the active virus. We're going to be doing those at the office, sending them to a lab in San Jose, and you'll have results in around 72 hours, less than 72 hours.
Okay, that's good news.
And also on the testing side, there's an at the moment anonymous initiative that there could be the possibility of private mass testing in Nosara, which would be awesome. And if more people want to join in this effort, it would be hopefully to do mass testing in Nosara to actually determine the amount of positives and asymptomatic or symptomatic cases in Nosara, which would give a really good x-ray. This would be a private initiative that hasn't been done in the country. Health Ministry is looking forward, and as well as the hospital and the epidemiology department, but it's still in initial stages. Hopefully this can come to fruition in the next 2 or 3 weeks, but let's see. It's starting.
So we'll stay tuned and see what happens there. What other updates do you want to get out there?
There's well, I wanted people to definitely know that there's more cases than appear in the numbers, that people need to take care and see what's happening. If you have any doubts, we're doing the testing, and also give us a call if you have any questions. Health Ministry is a little behind on notifications. We also have we went through a thorough process of a safety compliant COVID seal done by the Cámara Costarricense de Salud. And that means that we have all the protocols in order and all the knowledge. And, you know, we went through some process to keep our patients and our staff as safe as possible. So to have the safest possible practices to avoid contagion of the virus for any of our patients and amongst the staff. So we're pretty happy and excited about that.
Yeah, so that's the nerd. It's scary to go to a place where people are getting tested for COVID. You don't want to catch COVID. So
exactly.
Yeah, that's great that you have all that protocol in place. That's good to hear.
Yeah, if anybody's interested in with this private initiative, you're more than welcome, and hopefully it's to test as many people in Nosara to give us a really good x-ray so positive cases can actually be isolated, and we know what's happening epidemiologically with COVID in Nosara.
Okay. Hey, thank you for everything. As always, I guess we'll talk in a couple of weeks to see how this testing initiative's going.
Yeah, we started last Monday. We're probably going to be testing Monday, Tuesdays, and Wednesdays, so we have enough time to make sure that gets to San Jose safely. Because obviously people don't want to redo the test. Hold on. So the testing procedure goes, the swab goes into both nostrils. The description of it is that it feels like when water comes up your nose, and the process is fairly fast, painless, but a little bit uncomfortable. I already did it, so I can tell you that my COVID test came back negative, and that it feels a little weird, but it's really manageable.
I had it when I had my accident, and I had the nose one, and it
Huh?
wasn't horrible. It wasn't as bad as I had heard. It wasn't comfortable, but it wasn't horrible.
Yeah, exactly. That's just I want people not to be so scared about it.
Yeah, just do it. It's really not that bad. You just got to get it over with.
Okay, folks, man. Let me know, and I'll keep everyone posted as much as I can.
Okay, talk to you in a couple weeks. Thanks again for everything.
Take care, buddy. Thank you.